Hi guys, welcome back to my channel. If you're returning, thank you for coming back. And if you're new, welcome to the family. My name is Pearl. I post videos every week about nursing, medicine, faith, and lifestyle. Today we're going to continue the nursing series focusing on RNs versus BSN. So if you want to know more, then keep on watching. On this video, we're talking about RNs and BSN. I'm speaking out of personal experience because I was a BSN. I also did some research from the website of the Bureau of Labor Statistics. I'm going to leave a link below where you can go on there and do your own research if you want to. RNs, BSNs, who are they and what's the difference? RNs and BSNs are a subset of nurses who provide and coordinate patient care in collaboration with other healthcare providers like doctors, nurse practitioners, case managers, etc. However, unlike LPNs, RNs and BSNs do not need to be supervised by another set of nurses. They do anywhere from patient assessment to care planning and executing this care plan. They also educate the patient and the public at large on various health conditions. They provide emotional support to the patients and their families. What's the difference between RNs and BSNs? There's no difference in what they do. The only difference is in their education and their training, which we're going to talk about later in this video. Where do they work? RNs and BSNs work anywhere where nurses are hired, so doctors' offices, schools, hospitals, nursing homes, and residential facilities. What's their schedule like? They can work full-time, part-time, so 36 to 40 hours or less, days or night shifts. They can also do per diem, which is PRN, where the employer provides what hours they have available and you pick up what hours you want to work. You can do weekends or holidays, especially if you work in like say the hospital. But if you work in a doctor's office or a school, which are closed on the weekends and holidays, then you don't work on those days. If you work, say, in a PACU, where you care for patients after surgery, you may be required to be on call, where you be at home and then you get called in when you are needed. You can also choose to do traveling nursing. You're still gonna do your 3 days a week. I don't think you are required to do weekends or holidays. It just depends on where you're employed. So some places will require you to do weekends, some don't. So it just depends on where you're working at. Now, how much do they make? RNs and BSNs make on average 73,000, and that's on the Bureau of Labor Statistics website. But then you can always pick up more hours or have more than one job to make more money. Say you can work in a hospital and do your 3 days, and then on the other days that you're off, you can pick up hours in like a nursing home or just do group or what's it called home care and make more money. So how do you become an RN or BSN? You can become an RN straight from high school, where you'll be required to do prerequisites like biology, chemistry, anatomy, and physiology, and then you get to say community college where you can get your associate degree. Or you can become an RN with an associate degree after being an LPN. Then you're just going to do your prerequisites again, and then you get into your RN school. Again, it is always cheaper to do it, say, in a community college than like in other private colleges. How do you become a BSN? You're required to get your bachelor's degree. So you can either start from high school. Again, you're going to be required to do prerequisites like biology, chemistry, anatomy, statistics, and stuff like that. Just check with the school you're interested in attending. And then once you're done with your prerequisites, then you get into your program, which usually lasts about 4 years. There's also another way to become a BSN, which is what I did, where if you already have a bachelor's degree, then you can do an accelerated program, which is usually about 15 months to get your BSN, and then you can work as a nurse. So once you're done with your training, be it RN or BSN, before getting your first job, you need to be licensed by sitting for and passing your NCLEX RN. Schools are usually good at registering students for this exam and preparing them for this exam. With my school, we had a preparatory class where we did a review of higher concepts. They also taught us some exam techniques and just a general overview of the exam. So check with your school if they have this available. That's all I had for today. Thank you guys so much for watching. Please like and share this video and also subscribe to my channel if you've not already done so. Until next time, bye bye.